Autism spectrum disorders, ASD, are a group of rapidly growing disabilities. They are characterized by repetitive patterns of behavior, interests, or activities, problems in social interactions. ASD is a complicated neurological disorder that is characterized by behavioral and psychological problems in children. These children become distressed when their surrounding environment is changed because their adaptive capabilities are minimal. The symptoms are present from early childhood and affect daily functioning. Children with ASD have co-occurring language problems, intellectual disabilities, and epilepsy at higher rates than the general population. Childhood disintegrative disorder, also called disintegrative psychosis and Heller syndrome, is a rare disorder that is categorized under ASD. In the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, childhood disintegrative disorder, along with other types of autism, are merged into a single spectrum called autism spectrum disorder. Childhood disintegrative disorder has a relatively late onset and is characterized by regression of previously acquired skills in the areas of social, language, and motor functioning. It is not known what causes this disease, and it is often seen that children who have this disorder have achieved normal developmental milestones before the regression of skills. The age at which this disease manifests is variable, but it is typically seen after 3 years of reaching normal milestones. The regression can be so fast that the child may be mindful of it, and in the beginning, may even ask what is going on with them. Some children may appear to be responding to hallucinations, but the most common and distinct feature of this disease is that the attained skills are gone. Many children are already delayed when the disorder becomes apparent, but these delays are not always evident in young children. This condition has been described as a devastating disease that affects both the individual's life and the family. 1. The cause is still not known. The onset is variable. It develops in days to weeks, while in other cases, it develops slowly. It is not known whether epilepsy causes it, but children that have an autism spectrum disorder have an increased risk of having epilepsy. Childhood disintegrative disorder is associated with the following diseases, particularly if it is late onset: subacute sclerosing panencephalitis, a chronic infection of the brain by a form of the measles virus. This disease leads to the inflammation of the brain and the death of nerve cells. Tuberous sclerosis, TSC, a genetic disorder. Tumors formation in the brain, which is benign. It also affects other organs of the body like eyes, kidneys, heart, skin, and lungs. Leukodystrophy. In this condition, there is maldevelopment of the myelin sheath, causing white matter in the brain to disintegrate. Lipid storage diseases, toxic accumulation of excessive fats, lipids, in the brain and nervous system go too. Risk factors: autism spectrum disorder becoming increasingly prevalent, and its prevalence is reported to be 1 in 68. Childhood disintegrative disorder is a rare disease, with only 1.7 in 100,000 cases. And the prevalence of this disease is estimated to be 1 to 2 in 100,000. 2. Childhood disintegrative disorder is an uncommon disorder with its prevalence of 60 times less than that for autistic disorder, estimating a prevalence of 10 per 10,000 for autism. Parents and families who have children diagnosed with an autism spectrum disorder or other chronic diseases face many challenges. These challenges include social isolation, frustrations, a strained relationship, and financial difficulties. Helpful strategies include encouraging families to tell their own stories, thus assisting with emotional processing. The focus should be on strengthening protective factors such as increasing parents' communication skills, behavioral management, and providing psychoeducation for extending parents' understanding of their child's condition and developmental challenges. Other helpful strategies include connecting with others with the same disease, developing an alliance, caring for one's self, and become an advocate. Recommendations for healthcare providers include understanding the common problems faced by parents, building parent-to-parent connections, and encouraging a good relationship with parents and their children.